Hello, welcome to this very depressing episode of Heart Magic. I'm your host, David. I am a bicuspid aortic valve patient, and until a few weeks ago, apparently I had rheumatic fever and was close to death. And I did not know this until I got the most massive headache of all time. And this massive headache, uh, I get migraines, but went from 1 day to 2 days, and I was like, this isn't normal. And I said, by the third day, if it's still there, I need to go to the emergency room. I went to the emergency room and they said, yeah, it seems like you have a really bad migraine. But there's one more test you could do to figure out maybe it's not, maybe it's something more serious. And I said, okay, let's do the test. Turns out my brain was bleeding. And the reason it was bleeding was because I had rheumatic fever on my bicuspid valve. And yeah, it was bad news. I was rushed into emergency surgery. Now, at the time, they didn't think it was rheumatic fever related because I was not symptomatic for it. Apparently, I'd gotten sick months earlier. And the months earlier, it was just slowly building, and it had vegetation on the heart. That means there was literally like a little forest on my heart valve growing that could have flicked off and gone to my brain and done more damage. And yeah, I almost died. And it was it was so nerve-wracking I didn't even have time to be nervous. And I had a great brain surgeon. Shout out to Marion John Oliver at Lutheran General in Park Ridge, Illinois. He saved my life. He plugged the bulging vein with metal, with a coil. And basically what had happened is the bugs had moved to my brain and started to grow and expand. And, any day now it could have just, and I would have been dead. That's how serious rheumatic fever and endocarditis is. And it can be spurred, I think, through COVID. At the months prior, I felt awful. I thought that I was just sick. And, I have this thing where I'm just like, I'm tough. I got to keep going. And I just did not. I would go to the doctor and they were like, here's some light antibiotics. They were giving me the Mickey Mouse antibiotics. And what I really should have done was gone to a infectious disease doctor and gotten a massive dose of antibiotics, which no one likes taking antibiotics. But here I am having to take antibiotics through this PICC line. It's like an IV for 6 weeks to kill this massive infection in my body. Now, it has been gone. It's 6 weeks is like the protocol, especially for the fact that there was the vegetation on the heart. So that's what happened. I got sick. I got rheumatic fever. I got a vegetation growing on my heart valve. It spread to my brain, caused a bleed in my brain. I survived all of that, and here I am. I only have a little bit of vision loss on my lower left side. It's a miracle. Stem cells will take care of the vision loss, guaranteed, or even oxygen therapy. I have no doubt that I can heal that for myself. However, the reality is that I don't think that I'm going to be able to heal my bicuspid valve any longer. I think that this fever has really knocked me down several pegs from where I was. I was at kind of a moderate to severe with my valve, and I really wanted to do a lot to try to experiment and fix this valve and see what could really be done with prolonged fasting and all of these different things. But the reality is the valve is now prolapsed, and it's like an open gate. And that's bad news because another infection could go there. And I also could get blood clots there that could spread to my brain and give me a different type of stroke. So I'm feeling really screwed. And the options that are available to me are, well, first of all, I found myself a fantastic surgeon. Not going to say much more about him until I'm actually going through the process of doing it, because who knows what could happen. But he can go in through, make a keyhole incision and go in through the chest without having to open up the chest wide open. Fantastic news. Shorter recovery time. Way shorter recovery time. Less traumatic on the body. And you get the job done. On top of that, I mean, he can do valve repairs. I don't know if my valve is repairable, is the truth. And he may take one look at my situation and just say, do a mechanical heart valve. My hope is that I can convince him to do the Edwards valve, the bioprosthetic valve that has special things on it to make it anti-calcifying. And I genuinely believe in the power of that valve. I've seen studies where it's like 10 years out and there's basically no change on the valve. It's like perfectly fine. 10 years with completely perfect? How could I not get several decades out of that? In my opinion, I think it's very possible considering how healthy of a life I try to lead. And, um, I fast. I do lots of things where I feel like my valve would be clean as a whistle. But it's probably going to be surgery. And, I guess I'm more primed now for surgery considering I almost died through the last one. And it's like, you know what? I mean, there are complications that can happen with valves and surgery, but the fact that I did stem cells before and healed up a lot of my heart, I mean, I think if I had not done the stem cells before, I'd probably be dead right now. If I had gotten this infection pre-stem cells, I can almost guarantee you that I'd be dead. I think stem cells are an amazing thing. So leads me to, and people have been following me on this, specifically some of you, to get more information on stem cells. Let me tell you a quick synopsis of the stem cell updates. I'm going to make a more comprehensive video right after this. But I will say that I don't think that stem cells are going to help me in this situation. I think it's possible, and I would definitely have hoped to go do it. However, I knowing what I know now, had I known all of this from the beginning, I feel like there could have been, I don't know. I feel like what I know now really opens up a lot of doors to understanding how stem cells work in relation to heart valves. And as far as the aortic valve is concerned, it feels kind of hopeless at the moment. If I can scrounge up the money to go do stem cells, I might do it just to see, because it would heal a lot of stuff, especially after this rheumatic fever and stuff like that. But in terms of hoping that it's going to heal my bicuspid valve, probably the best course of action is going to be surgery, and it's just the reality of it. Now, are stem cells good for other people in other situations? Yes, I definitely believe that, especially for bicuspid patients. But you got to catch it early, That's kind of the factor of it. I'll talk more about that in the next video, but I think in my situation, it's probably looking like surgery. So, I'm going to talk about more stem cells more in the next video. Just wanted to update people on where I've been, what's been up, what's up with my valve, and the reality of my situation. Get yourself checked out if you're feeling sick. You don't want to mess around with these fevers and all this stuff. Protect yourself. A lot of good will come from it. Goodbye.